Coming up next, it's going to be the QEH Pulse Radio Show, brought to you with the compliments of the Queen Elizabeth Hospital, Martindale's Road in St. Michael.
Monday to you, all of you listening to us here on Q100.7 FM for what is another edition of the Queen Elizabeth Hospital Pulse Radio Show. I'm Shane Seeley, communications specialist. As usual, we have a lot to share with you on this beautiful Monday morning. Outside is pretty bright. We have not had the recent floods over the weekend as has been the situation with the previous weekends. We were blessed with some sunshine, and I hope that everyone had a grand weekend. We know that we are in the middle of crop over, or getting into, what is the height of the season. But I want, for you, those of you listening to us here, to keep health top of mind. And that's why we spend this time with you every Monday from 11 a.m. to midday, sharing all that is happening at the QEH so that we can demystify any myths that have been emerging from time to time, and just let you know how best you can utilize your hospital. So as I said, a lot has been happening at the hospital, and when I say a lot, we have a lot of changes. A number of things are changing at the hospital as we are really on a journey of modernization, not only digitally but physically as well. And you will see and hear more about that transformation across the board, across the hospital, over the next week or so, especially as it relates to our mortuary services. So media release we would have issued yesterday, and we're really advising everyone that our mortuary is about to undergo a major renovation and modernization, and all of this is aimed at improving the safety and functionality and overall quality of our post-mortem services. This is a project that forms part of the hospital's ongoing modernization program, and it will include the installation of a state-of-the-art negative pressure ventilation system. Now, this allows us to do things a whole lot better as far as mortuary services are concerned. It improves the separation of our clinical and family areas when we build out this kind of infrastructure, and there will be other critical infrastructural upgrades. These enhancements are designed to meet modern healthcare standards while providing a safer, more dignified environment for families, staff, and all who use the facility. Now, this is very important. To facilitate all of these works that are supposed to happen, all coroners and hospital post-mortem examinations will be temporarily relocated to Tudor's Funeral Home in the Ivy St. Michael, and this is effective today, Monday, July 20th, 2026. In addition, identification and viewing for post-mortem cases will also take place at Tudor's Funeral Home for the duration of this project. The renovation works are scheduled to commence next Monday, that's July the 27th, and are expected to take approximately 8 to 10 months to complete. So quite a bit of time, 8 to 10 months to complete all of this work surrounding our mortuary at the hospital. We do assure the public that this is a temporary relocation and it will not affect the quality or integrity of our post-mortem services. Our staff will continue to work closely with the families and relevant authorities throughout the process, and anyone required to identify or view a loved one in connection with a post-mortem examination will be provided with the necessary guidance and support. According to our Acting Director of Support Services, Jerry Warner, who's charged with leading this project, he says it represents an important investment in modernizing one of the most important and essential hospital clinical facilities, and the upgrades will significantly improve the environment in which post-mortem services are delivered, strengthened, and infection prevention measures will also be enhanced, and ensure that families receive services in a facility that reflects modern health care standards. It's all about moving the hospital to that next step. We do apologize for any inconvenience during these temporary arrangements, and we do thank you for your patience and understanding as we continue to invest in improving healthcare. And when I say we, the government of Barbados, and by extension, the team at the hospital, all we are trying to do is to enhance the quality of services provided to the people of Barbados. Of course, you can always call us for further information. Go on our website. All of the information is there. You'll see it in our news section, speaking about our temporary relocation of the post-mortem services during our mortuary modernization plan. And you can always call our PBX at 436-6450 and be directed for further details. So just one of the many things happening at our hospital. Very soon we'll be able to tell you about another project. Right now in the pilot phase, I'm just teasing, but it is geared to help improve the flow of patients through our hospital. So that's something that I will share with you in the coming weeks. So you'll hear more about that. On Saturday there was a newspaper article about the challenges that we've been having at our pharmacy. Things have improved since we last chatted right here on the Pulse Radio Show, and we continue to try to manage this new transition, this digital transition that is happening at our pharmacy. We have more staff on board now. We've partnered with a number of pharmacists, and we are getting more prescriptions filled. Sometimes it still takes time, but I want to advise you, there is an option. I know people like to do things Monday to Friday, but we are finding that on a weekend, and the pharmacy is open Saturdays and Sundays as well, we're not as busy in terms of the traffic. So maybe that could be an option for you. Try coming on the weekend if you had a challenge during the week, and get your prescription filled. I mean, the same message goes as was previous. We want you to do these things in terms of getting that prescription filled 3 to 5 business days in advance, and that is for the medication delivery service too, yes. But we don't want you in a situation where you've run out of your medication, your essential medication that you need for your condition. So we always want you to check in a bit earlier before it runs out, so that you can have that essential medication in your hands that you can take. So that is important. But things are improving. We do acknowledge the experience of some of our patients, our customers, or those who we care for. We do apologize for the longer than usual wait you would have had to bear during this transition period there in the pharmacy. But we are doing our best to ensure that you get your medication prescriptions filled. You have your medication in hand so that you can take and continue your regime as far as medication is concerned, because that is important to get you back to some sense of normalcy. You would have gone through your rounds with us at the hospital. We would have taken care of you, but then when you exit the hospital, you must have your medication then, and then for those repeat prescriptions to be filled, we want to get that done for you. So for those of you coming in, you pull your number, you get in line. You've had to wait some time, a bit longer than usual. Recently, things are continuing to improve, and we just want to say that we are doing our best. I really must salute the team now, in some cases working overtime to make sure those prescriptions are filled. We really want to thank you that our pharmacy staff for your service, your commitment to the task as you manage what is a critical transformation to the platform that supports the health information system. It is really, really important that we move to this next step, as Dr. Forde would have explained last week, and as he will come and explain very shortly. We make this transition, we need to make this transition so that we can improve further how we deliver our remit at the pharmacy, how we deliver on that remit, how we push our pharmacy services, how we get the medication to you so that we can fill prescriptions even faster. It will help improve it across the board. And all of these things, instead of having that piece of paper in your hand very soon. I know many of you are tech savvy now. Many of you have your mobile phone in hand most of the day, making your various transactions and checking up on what you need to check up on. Hopefully going on our website, qehconnect.com, and getting all the information you need about our hospital. You'll be able to then go on an app which is catered to the new health information system when it goes fully online, and you will be able to manage all of your healthcare attributes from there. So these are the many things, the many moving parts happening at our hospital, and we just want to keep you informed, keep you updated. Accident and emergency department, the team there working phenomenally to bring down the numbers. We would say it's not in surge now, but we just want to urge the public as it relates to accident and emergency too. You know, you need to consider, we always want you to get the information that you need. So call 536-4800, the Patient Advice and Liaison Service. And that can help you make a determination about if you need to come to the accident and emergency department at that time. Maybe you can go to a polyclinic during the opening hours. Maybe you can go to the Winston Scott Polyclinic, because you are not an emergency or an urgency, but you need care. So you have those options. We want you to consider that. But please, 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 know that we have those options to help you make the best decision, because we know that your time is precious. We don't want you waiting any longer than you need to, and you have options that you may be able to get through a bit faster, but still receiving the best quality care. So just a reminder for you as you navigate the system that is the Queen Elizabeth Hospital, whether you come through accident and emergency department, whether you come to the pharmacy, and as I explained at the top of the show, the situation now with the temporary relocation of our post-mortem services during our mortuary modernization plan. And then there's the Enmore redevelopment project, which means a lot of departments have already moved, and we still have to tell you about the ENT clinic and exactly where that will be located once it is moved. Not moved yet, but that is the final piece of the puzzle, and we will get to that, I'm assuring you, by next week. Dr. Forde, Dr. the Most Honourable Corey Forde, Director of Clinical and Diagnostic Services, here with me now in the studio. Good to have you. Know you've been super, super busy.
Yeah.
But you promised me a part two, so you couldn't leave me out. I appreciate you coming. A lot to do. And I know one of your first stops every morning for the past few weeks has been our pharmacy, and we continue to try to deliver as much as we can.
Yes, it's a pleasure to be here and to continue our conversation about the directorate. Yes, one of my first places every morning, even before time, is obviously the pharmacy, just to see how things are going there. We continue to work our way towards that process with the introduction of the new system within the pharmacy outlet. As I've said before, we continue to work towards improvement within the system at present, and I believe in the future, ultimately, that we will achieve what we are trying to achieve.
And that's what's important. The work continues.
Yeah.
We have, as we always do, we sincerely thank you for your patience, and you're going to get things right. I think once the technology becomes more familiar with our staff, they will get through the processes a whole lot quicker, and we can speed up the delivery of service there. Under your directorate, you mentioned a number of landmark achievements
Right, so
so far. And we went into a few of them last week, and there are still so many more components which fall under clinical and diagnostic services.
yeah. So we spoke last week about teleradiography and the movements where that is concerned, and that's an ongoing project. By no means complete in terms of when we continuing on and providing the amount of service that there is certainly to our accident emergency department by teleradiography services ongoing project. We would have spoken last week about the gains in terms of the 3 years back from February 2026, which this year, 3 years back, where we've almost cleared that entire backlog. And then we can go on to speak about some of the other divisions and some of the continuous improvements that we are seeing across the system. I think one of those departments is dear to my heart. Is infection prevention.
I was about to say IPC, HIPC.
Infection prevention control. We continue to do our one of the things in terms of the whole course of management and the whole course of improvement within that division. Obviously, we've done a few things, more than a few things, but increase our surveillance across the system to see how or to be the aim, of course, of trying to prevent hospital healthcare associated infections is something we continue to do. We've increased the amount of persons within that department, but we've also cross-legged now with antimicrobial stewardship, and cross-legging with antimicrobial stewardship, we'd have brought down a colleague who I know from Canada who would have helped in training of persons what we call antimicrobial stewardship. So in short, what that means is how do we use antibiotics in the way that they should to try to prevent the development of resistant bugs within the hospital setting, but also within the community. So we had a massive training on that, and also the development of what we call a hospital antibiogram, which gives a lay of all the bad bugs really that have ever passed through the system, and what for the last year, and what they're sensitive to on the platform, and how does that impact a patient. So we know patient in the hospital, we have fever or they need treatment for infection, we kind of know from the beginning what to start. We also developed a very soft project, which is part of the whole stream of the program. We also developed treatment guidelines for common infections, so we know which antibiotics we'll start, and that was not just based on something we picked off the internet, but based on our whole profile at home. And what that means is that, in essence, you get to start the right antibiotic from the beginning, which can decrease your length of stay in hospital technically. Additionally, in line with that as well, which I think is also important, we have continued our cross-link with the microbiology laboratory. The microbiology laboratory had a major transformation in terms of equipment, as I've mentioned before, and it was here, and now you're joining the process now of kind of analyzing that information, which would lead obviously to the better treatment of persons on the ground in terms of timing, etc. So we're winding our way through that. The staff is being trained on those pieces of equipment continually, and we are gathering that information to try to make a change on the ground. So that's the technological improvements in terms of service delivery that we continue to look at. So a whole fleet of new pieces of equipment. I think it was about $3 million investment in the microbiology laboratory to move them from a more hands-on, some more people can do things more technical, as opposed to be doing the techniques and doing multiple techniques. You're now
Okay, so
to
moving
more-
from a manual to a
system.
more
There you go.
automated
There
system.
There you go. My words caught me out just now. I rushed here literally. It was in
But-
the middle
but-
of an emergency.
I already
So,
apologize on
Yeah,
your behalf, Dr. Forde. You were busy dealing
yeah.
with matters on the ground that couldn't be avoided,
Yes.
and we appreciate
So
the time
move-
that you can spend with
So
us.
moving to that more automated, see the words are not bad. So moving to that more automated system is a major thing for that department. Having the staff trained as well during that process certainly is very important. So that interlinks with infection control, because if they're able to identify bugs earlier, faster, we're able to isolate people when it needs to be isolated appropriately, but also you get to start them on the appropriate antibiotics as well. I always make the point though that some people might say, oh, it might take 2, 3, 4, 5 days, but we put the bugs in an environment where they can grow, and we don't get to decide how fast they grow. They decide how fast they grow. So that's also a part of the picture, and that allows us to make those clinical decisions. I think the other division, which I want to talk about since I'm a bit late on, is obviously Clinical Nutrition Services. It's one that moved late under our directorate, and those are the dietary folks, the dietitians, nutritionists, therapeutic dietitians, etc. And that's one that I have my next focus on and trying to improve within the system. And I think this is important. With the advent of multiple non-communicable disease challenges in the community, we need to impact the system, not only through making sure people get medications or take their medications, but also to make sure that they eat right as well, and to also ensure that they not only eat right, that they know the things they probably shouldn't use or should use when they have certain chronic diseases. For example, somebody who's a renal patient, for example, you wouldn't expect them to be consuming a large amount of coconut water because the potassium related issues. So some of these things become important. So with that in mind, we have devised a program which we hope will impact things even greater. And part of that program involves, first of all, moving to a system where we just don't really focus a lot on outpatients in terms of clinical nutrition services, but we have a much larger footprint in terms of inpatients. So if people are being admitted with our readmissions, whether it be heart failure, or people with kidney disease, or people with diabetes, recurrent admissions, it may be very well that people may be unclear as to maybe thinking that this is right for them, because the system or the world out there is that you call it your friend say, I use this and it works for me, or I use that and it works for me, but everything doesn't work for every single individual. So with that in mind, we hope to see a larger footprint in terms of people being admitted to hospital. So I give them that dietary advice with the whole aim of stopping the revolving door of people coming back through the emergency department, maybe because of dietary issues, too much fluid, too much sugary foods that they might not even know that may be problematic. And I think that's one of the things that needs to be addressed on the ground. And so that's one of the major things that we'll be working towards in the next phase. There are going to be some acts, of course, as we go through that, but I'm sure, as always, that the general public will work with us as we try to maneuver through that system as well, and really beef up our inpatient services in terms of dietary nutrition within the hospital.
Yeah, because it is an essential part of the return to health.
Yeah.
Getting that diet right, and we hear about the challenges all the time. A lot of the challenges with chronic non-communicable diseases come from what you put in your mouth, what you eat, and what you eat on a regular basis, which kinds of dictates where your health, the direction your health goes. And these are some of the other components where we encourage Barbadians to take some personal responsibility for eating better, getting exercise, and getting enough rest as well. Those are 3 important cogs in the wheel towards which promote better health. And our dietitians, salute the work that they do there as well across the bridge. They're very important in helping people get on track, understanding where they're going wrong, and then pulling them back and saying, you know what, this is what you need to do as far as your nutrition is concerned for you to get back some sense of health. You're listening to us on the Pulse Radio Show. We have been chatting a lot this morning about a lot of developments happening at our hospital. Those numbers to call: 434-1007. 434-1070 is another option that you can call us at. And you can send a WhatsApp to us as well at 434-1007. Dr. Forde, you had a number of calls to make last week to make sure that everyone was getting what they needed to get.
Yeah, I am a man who follows through.
Yeah, I was supposed to. There was one patient. I know our patient advice and liaison service, they were to follow up on it, and I was going to call this morning in person to make sure that that individual doesn't call and say, this is a third time that I've been calling about this situation. We want to follow up on those
I hope not. I mean, all the ones that if they're listening,
you did say that to me.
All the ones that I called before I even left the radio station, I started to call people just to follow back up on the matter, and I'm sure that most of them hopefully have been brought to a conclusion. I think the other thing that I want to talk about as we go through changes within our system, our improvements within our system, our technological advancements, they are often challenges that go along, and I ask the public in the sphere of things to work with us as we go through. I mean, ultimately is towards betterment within the system. We may not see it now, but certainly you'll see them in the future. I mean, when I came in the door, I heard you talking about as the system develops.
You're getting calls on the radio show and getting calls while on the radio show. Yeah. That happens from time to time. Yeah. But yes, when you came in, I was speaking about a number of things, but really the point I winded up on was trying to advise people how best to decide whether they need to come to A&E or not. That is one thing that I think is very important for us. We never turn away anyone from coming to the accident and emergency department, but just have that acknowledgement that if we stabilize you, we make sure that things are going to be okay with you, and then you're not urgent, then you will wait behind those other cases that come in, which are very, very urgent. And our teams have to make that call through triage. They have been improving in their times, the triaging times, the flow in A&E has seen some enhancement as well, but we got to make those calls for the betterment of our patients. Mm-hmm. So that's where some of the weight now comes in, when we see that you're not urgent as we would have thought, or as urgent as you would have thought. Mm-hmm. Then those other urgent cases we will need to deal with, because many of those situations are life or death.
Yeah, true. I think we'll work our way through that as a system, and I think there are mostly Barbadian public are seen as very responsible, and I think they understand those challenges. I just want to stick a pin back, speaking about infection control.
Mm-hmm.
Obviously coming in a bit late, a bit disoriented coming through the door, to be frankly honest. I'm really trying my best to get here. And one of the other key things I think that infection control did is something that is really, I think, infection control 101 and preventing infections. And my hospital infection control 101 is hand hygiene. One of the things that we focus on big time within the system is trying to encourage people to use appropriate hand hygiene. Not only visitors, because I see people using it all the time, and I continue to encourage them to do that. Congratulations to you. Our staff to continue to do it, and patients, right? So one of the important things is one of the most important reasons for spreading of infections is actually a lack of hand hygiene. So if you don't get hand hygiene 101 correct, then
you're putting yourself in danger.
Trouble. And so one of the things that we do is we do regular audits of the entire system with the aim of seeing where we can improve, talk to people, use different educational strategies. You would know that a part of the service delivery and improvement for patient safety, more often than not, would be to encourage people to continue to use hand hygiene. We had a major hand hygiene campaign, Hammer the Bugs, Stop, Think, Go, and Hammer the Bugs. And that's been ongoing, and that started in January as part of the whole, policy development.
I think we even had a mascot.
Oh, we had a mascot. Oh, yeah. Mr. Bug, Mr. Germs, I should say, Mr. Germs. And that was quite well. I think the turnout was amazing from the staff, and now we are monitoring that on the ground to see the output of that on the ground. I think you have to watch and see where that goes, because somehow in our audits we recognize that there needs to be improvement in certain areas, and we focus on areas where we decided to take on the entire hospital. At the end of the year, we have a very nice program for where we actually allow people to develop internally a jingle, videos. So people have submitted, lots of people submitted various things, things that we're going to look at to see, and we'll use that next year as the master stroke for hand hygiene within the hospital, so that the staff who are in the hospital are involved in the process of improving things in terms of improving the whole aspect of hand hygiene. It is known globally that if you get hand hygiene correct, then the risk of spreading infections is much less within the system. And while we say that, we obviously need to continue to monitor the system with the aim of trying to decrease these particular bugs in hospital. The truth is, the bugs are out there, and the truth is they can spread by these hands, these 10 fingers that I have here. And what we do when we come into the system is important. I always encourage patients. I mean, there are some countries in the world, like for example in the UK, who reversed it a little bit and said, hey, if you did see your doctor or your nurse use hand hygiene, ask them. Don't be afraid to. There's nothing wrong with that, because it's important in terms of people dealing with persons, but also reducing the spread. And while I'm on that, people think gloves is a protection, right? It's a protection for me, who's using those gloves. But if I use those gloves and I use it on another person next door, and I then take them off and change them, use hand hygiene, I will spread the bugs on the gloves to the next person. And I think that is one of the other training points that we really, really, really harped on. And I would say so far the figures are not looking too bad. Certainly we've improved in terms of hand hygiene post that campaign, but it's a continuous, ongoing process that we are currently doing within the system and with infection control. I want to take the opportunity to shout out to all of my infection control colleagues.
Your favorite people.
I'm not going to comment on that. You're trapping me. So all right. So I want to say thank you for the tremendous effort that they put in. It's been customary of me once I'm on to really salute the staff for their efforts. Sometimes in challenging scenarios, and sometimes working above and beyond what they're supposed to. I think as a healthcare professional, there are lots that we have to deal with on a day-to-day basis.
Well, after 2 well-attended staff town halls where you would have done your own education
and training about Ebola.
Yes,
Ebola is up, and we did
not only Ebola. Maybe you can talk a bit about the training, because we don't get that up. We try to show and allow our listeners to hear a lot of what we're doing behind the scenes to get things right. Yeah. But we're also preparing in a global environment.
Yeah, and we're preparing for things, so people don't get to see that. It'd be great if CBC could come and see us in practice, or maybe not. but
you practice, you feel, but you try again to get it right.
So we come up with various different scenarios. We've subdivided groups within the system to deal with some of these highly infectious diseases. We have 3 training groups. And Group A, Group B, and Group C, trying to prepare for any contingency or anything that happens. I mean, with Ebola is a little bit down now in terms of publicity and out there. But one never knows. Risk is low, still remains low, but one never knows. It's always better to be prepared than be surprised. So it's one of the things that we've done. We've done extensive training for general staff in terms of sensitization. As you well know, there's a huge crowds that turn out filling the auditorium. But then we had this smaller group of training and how to use these specialized pieces of equipment. So this is something that we've been doing and being really, really busy trying to make sure that we are certainly in a position that we can respond.
State of readiness.
Yeah.
State of readiness,
appropriately.
indeed. And another department under your portfolio, under Clinical and Diagnostic Services, that is really the lifeline, no pun intended, is our blood collecting department. A real lifeline for what we do in terms of trying to save lives. And you've had a lot of traction there at blood collecting,
I just want
especially
to
last month.
Absolutely. I just want to take the opportunity to thank all Barbadians on this matter. Like, I think as a country, and I mean, there are lots of things we go through, there are lots of things sometimes we don't get right, or there are lots of things we get right as well. But I think as a country, I think when we ask for help or we need help, I can say honestly that Barbadians do come out and they assist. And one of those are, anytime we have a blood drive, people come out and assist. Even if, and I want to congratulate Blood Bank as well, because sometimes somebody may be out sick or whatever, people come out on their time, overtime, or even stay on to make sure that we achieve what we want to achieve. Use the opportunity to thank them again. But just want to thank all the Barbadians who come out on a regular basis and donate blood. And you don't know who you're donating for. Hopefully it may not yourself. I always tell people the blood bank and blood collection is like a bank. You carry $100 to a bank. When you go back to the teller a month later and you ask back for your $100, hopefully with interest, you don't get back the same $100, but it's all the same within the bank. And like I said, in the bank, if you take all the money out of the bank and you don't put anything in it, then there's no money to give to anybody. And so it's important for you to continue to step forward and assist in this manner. You save so many lives that you don't even know by that simple action that you take to assist a person you don't even know. And I just want to, again, because of the turnout last time around when we asked for help, I just want to again use the opportunity to thank all of you, honestly, for coming out and assisting to that person, maybe a child, maybe an adult, or maybe somebody who was in an accident, maybe even be one of your family members that you came out and donated for. And I think that that's truly commendable. I think the other thing that is important as you donate blood is that you don't just donate blood and you just give it to the person. It goes through a whole series of screening for many different communicable diseases like HIV, syphilis, hepatitis B, etc., hepatitis C, etc., HDLV1, etc. And that also gives you some added information on your own self as well and your own health, which is also important as well into day-to-day living. But the blood that you give is literally a lifeline for somebody else who's not able to do it. And if we live our lives like that, then I think we'll continue to do better as people. I always say this, and I'll say on the call today. I'm a little different on mode this morning coming in, so forgive me if I'm not my normal perky self. But I just want to say that, as we go through changes, not only in life, but as we go through changes in developing our own healthcare system and building our whole healthcare system, there are going to be some challenges as you go along. But it's how we manage those challenges, how we acknowledge, when we don't get everything right, and we try to pull it back and put things back together. And it's one of the things that, this is our one healthcare system. And I think that one of the things that we need to do all as responsible citizens as well, as responsible healthcare professionals, is continue to try to build our system to where we would like to see it.
And we'll come back to that in a matter of moments, because I do want to thank Corporate Barbados for showing up during the month of June Edgy Women, PwC, so many other partners coming on, coming through the doors, where Wendy Lord and her team would have, of course, done their part in getting that blood, getting those blood donations and putting them into our blood bank so they are available for those who need that lifeline, for those who need that support. Big thank you to Corporate Barbados, and I will say that I said it then. I'll say it now. I'm thinking that you don't have to wait to that specific month when we know it's blood donations to do it. Any company can pick any month and say, hey, this is my month, where the leads and our employees will give that gift of life and come through our doors, and our Wendy Lord will make sure she takes care of you, explain to you everything that needs to be done, take you through those processes, and you have that opportunity to donate blood and give the gift of life. You're listening to the Pulse Radio Show. 11:43 is our time. We have a caller. Good morning, caller. Welcome. How can we assist?
Good morning.
Good morning.
I attend the hospital, right, with my eyes. I get one card, so I had to get another one card. And when I went back and give me the 6th of January last year, they tell me nobody gonna call me.
Mm-hmm.
And there's a whole almost 2 years and nobody called me back yet.
So you said January?
January last year. January this year will be a whole year.
Oh, and you haven't received a call?
I never received a call.
So you need to call, please, if you can, 536-4800, and let them guide you and try to and help them to help them. They will help you understand what is happening and see if we can get you back on track. Also, please leave your number with Kimberly Skeet, our producer today, and we'll take that and we'll follow up with you to find out what is happening in this case. But it's a weird one, not getting a call. You should have gotten a call for your appointment or for what is the next stage of your care with us at the QEH. So apologies for that. But please leave your number with Kimberly, and also when you put down from her, you call 536-4800, explain the situation, and I'm pretty sure we'll have one of our team members there that can help guide you through the process.
Well, ma'am, I'm
Hello?
sorry. I'm
You
here.
did you hear me just now?
Yeah, I hear you.
Okay.
Yeah, but I'm just to say
Yeah,
that we're sorry that has happened to
Uh-uh.
you. Ma'am, can you hear me?
Yeah, I can hear you good.
Hi, Dr. Forde. I'm sorry that this has happened to you.
You tell me to leave my number with Kimberly.
Yeah.
Okay.
Dr. Forde is here giving you some more advice as well.
You heard me?
Yeah, I hear. Are you listening?
You're listening. No, I was telling you that we're sorry that has happened to you.
Yeah, I hear that
and,
part.
and we hope that that we can get this resolved. You just follow through with what our communications specialist, Mr. Silly, has told you, and we try to get that started for you. Okay?
Okay.
Okay. Have a fantastic day.
You too.
God bless. Bye.
Thanks for calling and sharing with us, because some things slip through the cracks and we need to get back on track and get you back on track so that your eyes are taken care of. Yeah. So back to the blood collecting department. It's there in Lady Mead, Winston Scott Polyclinic, right next door to the Winston Scott Polyclinic. Go there, and as I said, the team there will give you some guidance on how you can donate what is a gift of life. And maybe for our listeners, Dr. Forde, you can explain how important it is that we go through this exercise, how critical it is. How critical is it to have these types of donations, blood donations, at our hospital?
Yeah, it is something that is very critical, and I think from a day-to-day basis, there are people who need chronic blood transfusions for different issues, which may be blood related or what we call hematological problems. That's ongoing, and there may be people come in acutely, for example, who may unfortunately had a stab injury or accident or a gunshot wound, etc. And those persons sometimes may need assistance in terms of blood and a donation of blood. And then there's those with special conditions who need things like we would call platelets, or they may need other blood constituents, and we get the opportunity to use those constituents which are tested to give people to try to prolong their lives in sometimes dire circumstances. So, like I said before, what I've recognized is that people come out and they donate and they support. It's not something that we have to we keep begging for. I think once people know that something is needed, they do come out. And I think sometimes we spend a lot of time commenting on all the bad things that happen, but I want to commend Barbadians for continuing the course of the continuous donations, and the companies, salute to all of them that you've just mentioned, for coming out and supporting our blood drives. But make it a normal event. Come in and donate it every 3-4 months. You come and donate blood. Let's make our blood bank rich with blood.
But I also want, like, it's almost like normalizing or trying to get something to be second nature.
Yeah.
And that's what we want the action to be.
Yeah.
Something second nature, oh yeah, it's my month to give blood.
Some people are scared of needles, but it doesn't hurt like you think. Okay, so just come and have the experience.
You can see my hand up. terrified. But when you got to do something, just do it. I shut my eye and try to get it out of the way, and try to overcome that fear. But difficult. I think we have another caller here on the Pulse Radio Show. Good morning. Welcome. How can we assist?
How are you?
I'm well. How are you doing?
I'm holding on. This is Marcy. I want to say thanks to you, to Mr. Forde, Secretary, and any dispensary that they call me to choose tonight, and I get my medication to Wednesday. And I want to say thank you.
I'm so happy, and thanks.
Yes, please.
Thanks for calling.
Yes,
we hope that not have this happen to you again, but I'm really, really happy that we were able to make a difference for
please.
you.
And I want to say get well wishes to Mark Anthony.
Yes, indeed.
Yes, please.
He actually he's recovering, and we wish him well. We wish
him a speedy recovery. We will pray for him.
Thank you for calling.
Okay, thank you. Get home safe. All right, bye-bye. Thanks.
Yeah, that's good news. See, everything is not bleak in Blunder.
Yeah. A friend of ours, Anthony, he works with us here at the CBC. He has a family here, and Cave Shepherd family. We're wishing him well, wishing him on the road to recovery. But as our caller there just now alluded to, she called to get the medication, and 24-hour turnover. So we're happy for that. We're going to see a lot more of that coming back into the system. That 24-hour turnover, we're working on it. It's a work in progress, and I'm pretty sure that under Dr. Forde's leadership, we will get it right. Another department, you have a good few departments under your directorate, though, Dr. Forde. The other department which has seen some upgrades as well are laboratory services. Our laboratory services, the lab would have received some new equipment.
Mm-hmm.
There were some environmental enhancements, a number of things happening there as well to make the situation not only more comfortable but more effective as far as the lab. And it's a very important cog in the wheel in terms of healthcare. It's one that can be overlooked, but it's not overlooked when you're waiting on your results coming back from the tests that you may get in A&E or other parts of the hospital. The lab is a very, very critical part, and it needs to have that level of efficiency to deliver quality care for our patients.
I think for most people in the lab, they know fully support the laboratory. Probably one of my prime areas in trying to make sure that we have to support the laboratory. I think looking towards the future, we would expect in the expansion process or program for the lab to have few floors for itself in terms of expansion and improvement of services. I think what we're doing at this time on the ground, we're having talks about where we want to see the lab in terms of quality improvement within the next few years. We're looking to see how we can develop and focus. And I know those guys, and I always make the point that people see doctors and they see nurses and to a sense like orderlies, etc., because there are people in front of you. But people don't see the people who are behind the scenes, the people in blood collecting, the people in the main laboratory, the people who they may only see in outpatients but are impacting their nutritional services from behind the scenes. The people in central sterilization and disinfection who make sure that the instruments and the tools that are used are effective and efficient, and they're safe to use on our patients. These are the also the healthcare workers who are impacting our system greatly. And as someone who's responsible for many of these divisions, which people don't really see in front of them, I just want to tell the public, or interface with the public, to tell them that, because you don't necessarily see the people in front of you, and they're not in front of you every minute of every day, that these are the people who actually can make a difference in actually your management and the improvement of your management in terms of the laboratory tests, the results that come out, the timeliness of those results that come out, the response to emergencies, and making sure that the tests can come back even a bit faster in the emergent setting as opposed to a non-emergent setting. Like, these are the guys who made the difference behind the scenes, and I want to congratulate them. Sometimes they feel a bit unappreciated because they're behind the scenes, but these are the guys who allow me as a physician to make the right decisions in terms of antibiotics. They allow me to make those decisions which will impact patient care within the patient care setting. They allow every doctor who is seeing patients on a day-to-day basis to make those decisions. So I want to really lift up all of the technologists who do their best on a day-to-day basis, and all the clerical staff who also move things through the system so we can get appropriate results and get people treated. So yes, we have lots of big plans for the laboratory. It's not in this year's trend, but that is something that certainly will follow very, very, very shortly with the lab expansion services. We set up a whole quality improvement type committee within the laboratory, and led by the laboratory itself. I think it's important that we give the employees that opportunity to be part of the development process. That is, we don't take a top-down approach when managing these sort of scenarios, and that we include them, and we have their input. We have them to point out to us. They're going to know better where the challenges are going to lie than just giving them something and say, hey, use this or do this, or this is the direction which we're going to have. That input becomes important. I think as they go towards and gracefully the government of Barbados says it's going to be building a new extended hospital, and part of that is going to be obviously laboratory.
Big part.
A huge part of it's going to be laboratory, and I just think it's important for us to start planning ahead and looking to see where we need to go. I have those ideas in my head. They have ideas, and we put it all together.
I encourage anybody. I encourage everyone to go on our website www.qehconnect.com to see the visuals.
If I may, know we're winding down, but when you're part.
No, we actually have a caller on the line. Let me go to that caller quick before I give you that opportunity.
Yeah.
So don't lose the thought, Dr. Forde.
I'm gonna try.
I know.
It's a crazy morning. Yeah.
Good morning, caller. Welcome to the Pulse Radio Show. How can we assist?
Good morning, Shane.
Hi, how are you doing?
Not too bad. There's a sinful up woman.
A great parish. A great parish.
What I calling you about? Because I can't get in.
Mm-hmm.
My husband tell the hospital with the eyes.
Right.
And there's the 11th of February 2005. And they keep putting it back and then getting an appointment telling he on hold for surgery. But every time I go and ask a question, that's all they're telling me. Okay. But their last appointment here on the card is the 11th of February 2005. Because his last appointment was the 15th of October 2004. That was the appointment that he did get. Right, that he did get this. Now he get the 11th of February 2005. Every time I go, they're telling he on hold for surgery. That's all I'm hearing.
Well, it's thanks for calling so much, ma'am. This is Dr. Forde speaking. How are you?
Not too bad.
Okay. I'm sorry to hear what's happened.
Right, because I get mine due.
Yeah, I can't tell you, the exact reasoning behind it. But sometimes they may be. And I think maybe there needs to be some sort
I went up there twice, and all them telling me that he on hold for surgery. Because I got the card here to put, it got a pink card behind it too. Right, the 11th of February 2005. But his last appointment was the 15th of October 2004. But then they put no more appointment on the card. The just.
Yeah. So I'm not sure we're gonna give you a number to call to have somebody to follow up. Follow up this for you.
Yeah, that number is 536-4800. 536-4800. I'm gonna repeat it again. You don't have. By the time I'm done, you got run from the pencil.
Never got it.
536 4800.
5 3
4800. So you call that number, explain the situation.
36
4800. 4800.
4800.
Yes. So you call that number and they'll give you some guidance.
Thank you again, ma'am, and we hope we can get this resolved for you. Okay.
And you can leave your number with Kimberly as well. We can reach out to you after the show. Thanks a lot for calling.
Yeah, all right, thanks.
Have a fantastic day. Bye-bye.
I hope you haven't forgotten Dr. Forde.
No, I haven't forgotten.
Good.
I have 2 minutes to go.
So get into it.
Right, so I just also want to take the opportunity of thanks lots of people today, but now I'm going to speak to those who are growing up within the system, whether it be medical students or medical doctors or in school. I'm thinking about a career to get into, and they want you want to be a doctor. I want to use the opportunity this morning to tell you there are some of these areas that I've spoken about, and some of my areas are areas that you have an opportunity certainly to expand to. So for example, if you want to be an interventional radiologist or radiologist, it's something to think about in the future. If you don't even know what that is, look it up. You might find yourself interested in that area. If you want to do hematology, dealing specialized in blood areas. So there's so many different areas out there that I think that as we look towards the future, and as we develop systems and programs, oncology, for example, is another area that internally, certainly, these are areas that that you will get that level of support and mentorship for going into. And I think as we develop our system, we also have to look at like who we have, the length of time they have in practice, for example, and also we need to look at how we try to backfill those areas by having people go and train for improvements within those particular fields. So I mentioned a few of those fields just now, like oncology and radiology. You want to be even a radiographer, for example. Those are all lucrative areas. You want to be a dietitian as well. These are all lucrative things to get into.
Indeed. Good options for career advancement, good options for learning, training, and just serving patients and giving a level of commitment that we need to make sure that we continue to deliver the highest quality of care at our hospital. Dr. Forde, I want to thank you for spending these last 2 Mondays with me. I know that I've taken you away from what can be some very busy times for you, especially with all that has been happening now, but we appreciate you, and I know our listeners appreciate the time that you have spent with us, educating us on everything that is happening as far as improvements go under clinical and diagnostic services, all a part of our build out of the 2025 to 2028 strategy, and we will continue to share that with you right here on the Pulse Radio Show. So on behalf of Dr. the Most Honourable Corey Forde, our Director of Clinical and Diagnostic Services, I'm Shane Seeley, Communications Specialist. On behalf of the entire team at our Queen Elizabeth Hospital, we thank you for tuning in, and we will see you next week. Some more interesting discussions to have right here with you on the Pulse Radio Show on Q100.7 FM. See you then.
Thank Thank you so very much, Shane. Join us again next Monday, right here on Q100.7 FM for another of the Pulse Radio Show.